encapsulated dental cement is better than hand-mixed cement for dental restorations. Atraumatic restorative treatment is an appropriate option for preventing carious dental lesions. The most commonly used material for atraumatic restorative treatment is glass ionomer cement. Research has determined that high-viscosity glass ionomer cement can increase clinical survival rates compared to the survival rates when conventional or medium-viscosity glass ionomers are used. However, no data comparing the survival rates of hand-mixed and encapsulated glass ionomer cement is available. The aim of the study was to assess and compare the efficacy of powder, liquid kits, and capsules of glass ionomer cement used in atraumatic restorative treatment for Class 1 cavity in permanent molars. The patients aged 11 to 15 years having at least 2 occlusal Class 1 carious lesions were included in the study. The patients having teeth with pulp exposure, history of pain, presence of fistula, or swelling were excluded from the study. The study was a randomized, prospective, and split-mouth clinical trial, in which 40 children were included. The patients were randomly divided into 2 groups to receive either hand-mixed glass ionomer cement or encapsulated glass ionomer cement. It was observed that encapsulated glass ionomer cement showed lower failure rate than hand-mixed glass ionomer cement. Based on the outcomes, it was noticed that atraumatic restorative treatment performance was superior in encapsulated glass ionomer cement when compared to hand-mixed glass ionomer cement at baseline, 6 months, and 1 year. The study concluded that encapsulated glass ionomer cement improved atraumatic restorative treatment performance with low failure rate than hand-mixed glass ionomer cement.